Alors, mesdames, messieurs,
So, ladies and gentlemen, dear colleagues, welcome to this press conference to have an overview of the Quebec situation with regards to COVID-19. The Premier of Quebec, Mr. François Legault, is, as usual, together with the Minister of Health and Social Services, Ms. Danielle McCann, and the National Director of Public Health of Quebec, Dr. Horacio Arruda. Mr. Premier. Hello, everyone. First, the numbers of the day. We have 25 new deaths, a total of 241. I wish to offer my condolences to the families and loved ones of those 25 victims. We now have 11,677 confirmed cases. That is an increase of 765. 733 people are being hospitalized, an increase of 54. But when we look at the hospitalizations, we now have 186 people in intensive care, which is a decrease of 10 compared to yesterday. So what we see here is that the number of people that are hospitalized and in intensive care is still stabilizing. It's been a few days in a row now. Of course, we continue seeing deaths, and we will continue seeing a death toll, particularly in CHSLDs, because in CHSLDs we have people who are already ill, so they are more vulnerable once they are affected by COVID-19. But what I can tell you is that we're doing everything that we can to save as many people in CHSLDs. And this afternoon, Danielle McCann, together with Mike Blood and Dr. Ruyan, are going to be announcing a team that will make sure that each CHSLD, first, we have the right methods to take care of patients. That's what's most important, as well as ensuring that we do the screening correctly, so the tests as much on the patient side as on the staff side, as well as ensuring that the entire staff uses the individual protective material when they get close to the patients, when they go from hot zone to cold zone, the organization. I think that this is a really great team, and we have experts like Dr. Nguyen who are going to be helping us, making sure that we get organized in the best possible way in each CHSLD in Quebec. I would like to get back to the results of the day and the last few days, in fact. Of course, none of us like to see deaths. But if we compare results with those of European countries or the United States, we can see that the measures that Quebecers have accepted are giving good results. So when we look at it proportionally, we have fewer deaths, fewer people hospitalized. So our network, our hospitals are under better control than in many other places in the world. What we can also see, and we're prudent with this, is that we are reaching the top part of this wave. So we can see that the increases are stabilizing, so we are reaching the top of the wave. And on top of that, this wave is not as high as elsewhere, and not even as high as we had anticipated. So that's the good news. Of course, we'll continue following the results over the next few days, hoping that these results and this data continue being positive. There is every reason to believe that we are reaching that peak that we've been talking about so much. Then things will stabilize, and then they'll start decreasing again. And I think, at least I hope, that over the next few days we'll be able to get to a new stage. And today, I want to talk to you about us, about Quebecers. I want to talk to Quebecers first so that we look at what we've been doing over the past few weeks together. First, our guardian angels who have saved hundreds of lives of Quebecers. And the beauty in all this is that we've saved lives in people who are rich and people who are poor, both. So that is the beauty of our public system, which is a great advantage compared, for example, to what can be seen in certain other places in the world. But I'm also thinking about us, Quebecers as a people. Everything that we've done in the past few weeks, so quickly, the habits that we changed over the past few weeks, our lives changed over the past few weeks. We, of course, made important economic sacrifices, and we did so for the most vulnerable among us. I think that this honors us as a people, and we can be proud of that decision. That was, at any rate, I felt it, that was supported by the population as a whole. Of course, in the upcoming weeks, we are going to continue fighting, and I remain convinced that we will win this fight that we're waging together. Because Quebecers, the 8.5 million Quebecers, when we get together to do something, there's nothing that can stop us. And we Quebecers know that when it's 30 degrees below in January, or when there's snow in the month of April, as we saw yesterday, we know that beautiful weather is coming. We know that the spring will eventually arrive. And that's what I want to say to Quebecers. The beautiful days are ahead of us. Soon, once again, if everything goes as we've been seeing in the past few days, we will be able to prudently start reopening the economy and finding a more normal life. We will do so intelligently. We will do so by keeping new good habits that we've taken up in the past few weeks. And slowly, Quebec will be reborn, a little bit like nature does in the springtime. Quebec will be born again, but we won't be quite the same as we were before this crisis. And I think that in this revival, we'll have grown. We'll be more united, we'll be stronger, and we'll be able to, in the next few months and years, build a Quebec that is even more prosperous, even more proud. And that is perhaps the positive aspect of the crisis. So that is what I wanted to tell you today. Courage. Hope is there. We'll get there. We have beautiful days coming up in front of us. And I would like to end by wishing everybody a beautiful Easter weekend. Everyone at home, take care of yourselves. Thank you.
Good afternoon. Today, I want to say a few words about us, Quebecers. In the last weeks, we've all changed our lives to protect the most vulnerable. We can be proud of ourselves. We're doing everything we can. We're doing everything we can to win the battle of our lives. We still have a tough road ahead, but when Quebec is united as one, nothing can get in our way. We Quebecers know one thing. In the heart of winter, we still know that spring will follow. We know better days are coming. In the coming weeks, we'll gradually restart our economy, but we'll do it smartly, and we'll keep our good habits. And Quebec will emerge stronger and more united than ever. I repeat, better days are coming. So I wish everyone a great Easter weekend. Please stay at home and take care of yourselves. Thank you all.
Merci, Monsieur le Premier ministre.
Thank you, Mr. Premier. We are going to start with a question period. We don't hear about the testing anymore. It's been maybe a few weeks. Can we have a kind of idea of how many tests have been made up to now? How many are being done every day? Have we changed the testing strategy? We don't hear about it anymore from you. It's always been kind of left aside from the statistics that you're giving. I understand that there's a lot. I will let Dr. Arruda complete, but when we compare ourselves, every night I look at other countries, other states. We are at about 13,000 tests per million inhabitants. We are, together with Germany, one of the states that has tested the most up until now. We continue adding 2, 3, 4, 5,000 tests per day. But when we look at it cumulatively, for example, if we compare ourselves with Ontario, we have more than the double per million inhabitant as Ontario. And you did hear the Premier of Ontario say we have to increase the number of screening tests we do. So when we compare ourselves with the United States, we have double, keeping proportions, and we continue doing so. We've changed the priorities, as I was saying earlier on. For example, in CHSLDs, we really have made a priority of testing the staff and testing the residents in CHSLDs that are infected. So we continue testing. I don't know if Dr. Arruda has numbers to give you. I don't have specific, very precise numbers, but I can tell you that we're at about 5,000 or 6,000 tests and over per day. And what has to be understood as well is that the testing is continuing. But there has been a change of priority, yes, and we'll also be adding other kinds of tests, which are faster tests, PCRs, as soon as the technology that is being organized right now, which gives us results in the next 15 minutes, we'll do that. And we'll also zero prevalence studies to see which proportion of the population is infected to help us better plan what will happen, for example, in the fall. So our capacity is there and will increase significantly. And perhaps you have another chart here. He's better than I am. He's got charts. Yes, we're at 106,540 negative tests, 2,721 under investigation. The interpreter missed the number of positive tests, of negative tests. So that was one of the important methods. There's two important things to understand correctly: testing and keeping people as far apart from one another as possible. And along the same vein, you said, Mr. Arruda, that you were going to be making tests in general in the population. Do you already have statistics? Because you started testing in CHSLDs, generally speaking. But up until now, would you be able to perhaps give a certain percentage of the population with the statistics that you have until now, which is infected without knowing so, those asymptomatic people? No, if you'll allow me, the samples that we have in CHSLDs, etc., those are small volumes that we can't extrapolate to the population in general. It would be too perilous to do so. And the circulation in those areas that is greater than in the population in general. It's really only zero prevalence studies that will be able to give us that information, and we have to accumulate that information in function of their characteristics. And I also wish to pass a very important message. Our results, the courage of the Premier in making us take this important break has given us exceptional results, because we did not end up in a situation where the health system was completely stopped. But let's not think that because we won this one battle that we can't do things adequately and differently. That is, an opening that would be, quick, like an on-off switch, would bring that people who were not exposed, for example, people above 60, would get sick, and we could end up with the same problems that we wanted to prevent this winter. That is to say, coming back with curves. And I'm not the one who says it. It's everybody, everywhere in the world. Therefore, we have to, yes, reopen. We have to do it patiently and progressively, because nobody wants us to stay in this state. Psychologically, it's difficult. And for us first, we don't want to be dictators, but we want to avoid going up into an exponential increase that we've succeeded in avoiding, but that we would be plagued with over the next few weeks. And if Quebecers listen to what we'll be prescribing to them, with a spring outlook, if you'll allow me, I think that will succeed. But first and foremost, we had to be prudent and not think that it's open bar tomorrow morning as far as social distancing is concerned.
Bonjour, on comprend aujourd'hui.
We understand today that patient transfers towards CHSLDs will no longer be possible. How many of these transfers have taken place at the beginning of the crisis? And Mr. Premier, did you consider that it was an error to proceed in those transfers? No. I think that that's what had to be done, to take the people that we could transfer in CHSLDs to free up beds in hospitals to be able to, deal with the wave that we're expecting with COVID-19. But it has to be understood that the patients who were transferred from hospitals to CHSLDs are patients who were able to keep receiving the best care possible, whether it was at the CHSLD or the hospital. So nobody experienced negative consequences from these transfers. But now we've stopped doing it because we had freed up up to 8,000 beds, and we're bringing it back down to 6,000 or 7,000 because we're only using about 700 right now. So it won't be necessary to continue transferring patients from the hospitals to CHSLDs. But it was okay to have done it. And nobody, anyway, I made sure of that, nobody suffered from those transfers on the quality of services that were given. And if you'll allow me, I wish to complete what the Premier just said by adding as well that we also transferred people in intermediate resources and family-type resources. So that, too, is part of living environments for the elderly. And it is something that we do regularly in the network, and we had to do it imperatively because, of course, we had to be prepared for the worst-case scenario. I think that it was a responsible thing to have done in a hospital setting. Now, of course, things are changing and evolving, and we are stopping those transfers of new people in RI, RTF, and CHSLDs for the time being. It has stopped. But at the beginning, it was necessary to do so. And if you'll allow me, you'll see everywhere in the world there were health workers and people who were infected. At the beginning here, we had a profile associated to travelers. But one thing that we had underestimated, and this is true everywhere in the world, and it's only recently that has been seen, is the question of the asymptomatic vectors, or those who have very few symptoms and who are contaminated. It happened in CHSLDs, but if those people had stayed in living environments, I can tell you that there would have been more workers, healthcare workers that would have been ill and have made them ill, because unfortunately people in CHSLDs are often people who are much more ill and so at a high risk to die. But this is something that happened everywhere in the world. The healthcare workers acknowledge that perhaps we can transmit the disease even when we're asymptomatic, might have made it that certain patients were able to contaminate others, even though they were without symptom. We didn't know it back then, and you can look at the entire world, the literature, to be able to review this. This was a major factor, and that is one of the factors that makes that this is a disease that is transmitted, unfortunately, quite a bit, because even before having symptoms, and we didn't know that at the beginning. I didn't say that at the beginning. We said, that it was symptoms, but now we realize that's not the case, and this is learning, and it shows how new this virus is. It appeared sometime in December and January, now we're in April, and we're learning a lot more, and we'll keep learning things about this virus. Mr. Premier, you compare the deaths a lot with what is happening in Europe. When we compare to Canada, it's clear that the death rate per 100,000 inhabitants in Quebec is twice superior to what we see in the rest of Canada. What explains this situation? And since there's a lot of deaths in CHSLDs, are the practices that took place since the beginning of the pandemic be partly responsible for it? Well, first, if we had to compare ourselves, we had to compare ourselves with provinces that have big cities. So, Toronto, maybe to a certain extent Vancouver. And as we said, we were unlucky to a certain extent because of the spring break. We had a lot of people who traveled during that spring break at the very worst moment. Ontario had a spring break 2 weeks later, and that one was cancelled. So there is that effect. There's also the effect, and we're still analyzing this, there's a lot of links between Montreal and New York, and between Montreal and France. And we know that France is going through very difficult times. even still now.
Journal de Québec, Journal de Montréal.
You said, Mr. Legault, earlier this week, if we wish for workers to get back to work, what are we going to do with children? Well, the construction sites, you said, should be starting their activities soon. 190,000 workers in the construction industry, that's a lot more children in daycare centers, the emergency ones, if ever that is the case. Is this an area of going back to school on the 4th of May? Is that serious, or are we talking about an option that could be feasible? No, it's more than serious. We do not exclude reopening the schools and daycares before the 4th of May. So right now we're looking, in fact, and we will be following that. There's nothing decided yet. We are going to be following the results day after day, but as we've often said, children are a lot less at risk. What we will have to make sure of when we reopen the schools and daycares is that the children don't spend time with their grandparents. It's unfortunate, and I know that grandparents like to see their grandchildren, but for a certain time, we'll absolutely have to avoid that. But you can see it in the results. There's very few children who have serious consequences. So that will come. We're looking at various scenarios to see, a scenario where there's a partial reopening with parents, when one of the two parents can go back to work, or those who don't have young children, and perhaps as a second stage, reopen the economy once the schools and daycares are open. But all those are scenarios that we are studying. What we need is the agreement of public health. We're following that. Now we've had 4 or 5 good days with the results, and every morning I get up and, tomorrow morning, Sunday morning, I'll be looking at things and how they progress, and we'll be making the best decision for the population. I'd like to know, all the people who we suspect might have died following a COVID-19 infection, are they tested post-mortem, and are those data included in the statistics that you present to us every day? Yes. You have to understand that the vast majority of people who have a diagnosis of COVID-19 had the test, since we had a screening test. It did happen in a few situations that there were mortalities, and we did post-mortem tests. I can't give you an exact number. But those people are, in fact, counted in our statistics. But what we don't know is whether everybody does it that way. So when we compare our death toll per million inhabitants, we don't know if other states or countries are calculating all those who died of COVID-19 correctly. And we also sometimes have, let's say that we have 2 people in the same home. One had the illness and the other one died of it, and we didn't have a test. We consider that as being a case because it's a contact, what we call an epidemiological link. So the probability that the second person, even if we didn't check with a lab test, we count that epidemiologically. Not all provinces do it that way. That's why I'm saying that in terms of comparison, we have to compare ourselves. We do it. We look at what's going on in other countries. But when we make a comparison at this stage, even compared to Ontario, we're going to have to wait the end of this episode to be able to compare things properly. In the same way that things here are going well, but if we stop everything, we could end up with a scenario like in New York or elsewhere. We know that in certain CHSLDs, things are going very badly. The case of deaths are accumulated. You named 6 yesterday where the situation is particularly critical. There's distress in the healthcare workers and the residents and their families. This morning, the former head of the Laval Police Force, Ms. McCann, talked to you directly to be able to take the necessary measures. His wife caught the COVID-19 virus. Are you going to put those CHSLDs where it's more critical? Are you going to be doing something different with them? Are you going to put them under guardianship, for example? Well, usually I don't comment on a particular situation, but I would like to say that I have a lot of sympathy for the person that you're speaking of, and I understand their concerns. I must say that we are doing every verification about those CHSLDs that are in outbreak right now. We really have a very tight follow-up. And, for example, in the case of the Laval CHSLD, we added staff, and we are doing a follow-up with the management of the establishment. It's a worrisome situation, and we're sending reinforcements as a manager as well, because it's a lot of things to manage. And we're doing the same thing in other CHSLDs as well. Let's take, for example, in Mortality, Centre du Québec in La Flèche, we have the state of the situation. We're adding a lot of staff. I talked to you yesterday about reinforcement of 1,000 people who arrived, so we're adding a lot as well in La Flèche, and there is a stabilization of the team that will take place over the weekend, so every effort is made. We also have 5 in Montreal, and here as well, we're doing a very tight follow-up for Montreal. For example, in the southern part of Montreal, where we have 3 CHSLDs, where there's an outbreak, and we are in contact with the establishments, not only in terms of staff, but also the management, because it really is very demanding as far as management is concerned. And we have 3 RPAs, one in Chaudière-Appalaches, one in La Naudière, and one in Gaspésie, where the situation is under control. And I'd like to take this opportunity to say that our establishments are seeing to these situations and are taking every measure that we've taken, the protective measures, the equipment, the screening, the adding of staff to support the teams, but they also have to bring their support to residences for autonomous elderly homes. And there are certain residences where, unfortunately, the staff has been affected, and there were contacts, and there was almost no staff left. And it is the establishment, the CHSLDs, who brought their help and who took charge of that establishment. So what I want to say today is that we're doing a very, very tight follow-up of these situations. And for Laval, as you know, our National Director of Public Health told you that there would be an epidemiological study, because we want to know what happened. And also I want to add a little bit so that you know what's going on. I receive every morning the list of all CHSLDs and RPAs, the residences for the elderly, and they are in order of how many confirmed cases. So we start with the most cases of confirmed COVID-19, and I ask the question to the team: is the head of that CHSLD, is that a competent person? Is there enough staff? And I do that, let's say, for the 20 where there's the most cases. So there really is an individual follow-up that is done to make sure that we have the right people, enough staff, competent people to direct everything. If I could add something, because I want to tell you that, just to mention, in private and public CHSLD, we have 40,000 residents in Quebec. We have 1,054 confirmed cases. For RPAs, we have 131,000 residents and 291 confirmed cases. And for 39,000 residents in intermediate resources, we have 122 confirmed cases, and RTFs as well. Just to give you information that puts things in perspective, each case is important, and in each situation, we do a very tight follow-up. There isn't a day that goes by without hearing or reading messages from families that can't have news from their loved ones who are in CHSLDs. These are really heartbreaking situations and distressing testimonies. Many people are asking you to install perhaps attendants that would be responsible just for communications. Are you thinking about that? Well, it is fundamental. It has to be done now. We understand that the teams are overwhelmed, but we have offers. We even have specialists, doctors who are ready to come and give reinforcement in the short term, like now, because we know that our specialists, our doctors, because we freed up a lot of activities in hospitals. Well, I had many conversations with the president of the Federation of Specialists, and there is, and a doctor, a specialist is still a doctor, and they are really offering to come and bring help. And that is something that is being organized to really come into contact with the families. We have 450 family doctors that are already working, and they too will be involved in communications with the families. So I can reassure the families and the population that this is a great priority. Communication, taking into account the very particular situation that we are experiencing, and that has to be fixed now. My question is for Mr. Legault. You said that we were going to build a Quebec that would be even more prosperous. There's a ministerial committee that is thinking about the restructurization of the economy. I'd like to know what will happen with the fight against climate change. Will the environment have room in this new Quebec? Well, listen, the responsibility of the government in a recession is to do more rather than less, whether it be in the environment, whether it be all the road infrastructures, whether it be, hospitals, public transportation. It is time to accelerate. And I never miss an opportunity, such as yesterday when I had my telephone conversation with Justin Trudeau to say that we would like to have the help of the federal government in order to increase infrastructure. So, for example, in the environment, the projects that have been planned in public transportation, if there's one thing, is that we're going to accelerate them. I was speaking with Régis Labaume about this as well. I would like us to be more ready to accelerate things. So there's no question of delaying anything whatsoever. I also have a question for Ms. McCann concerning the help of those specialist doctors. Whether I understand correctly, there's many doctors that haven't been paid for many weeks because their situation, the role has changed. When will that be corrected? And how much are we going to be paying specialist doctors that are ready to do more clerical tasks, for example, in CHSLDs? Well, listen, first, we have an agreement with these specialist doctors, and it should be ratified very soon in the case of COVID-19. So that is the agreement that will be used. And we're not talking about clerical tasks. We're talking about medical tasks. Because when you communicate with the family on the state of the situation of the health of that resident, that is a medical task. So that is included in the agreement with the specialists. On Tuesday, with the specialists of the Institute, they talked to us about a peak around the 18th, and since now we've been talking a lot about reopening, but today you're saying that we are almost at the peak. Don't you fear sending a contradictory message and perhaps pay for it in the upcoming weeks? No, what I'm trying to do is to send a message of hope, to say that we're starting to see the light at the end of the tunnel. We are just on the cusp of reaching the summit or the peak, and then the numbers will start going back down. And I know that entrepreneurs, parents who have children who are perhaps a little turbulent, I want to give those people hope, but at the same time, we want to be prudent. So we will follow the results to be sure that we are at the peak and that we are not relaunching things. But at the same time, I think that we have to give a little bit of hope to the population. And if you allow me, I will add the fact that the teams of public health are not going to stop their interventions. Around each case and context, we will do the necessary intervention and that surveillance. Because what also has to be understood is that, for example, the young people who could catch the disease and not get any symptoms, it's as if we were vaccinating them. It's a natural vaccination that will install. And it's important that a certain part of a population in any society be vaccinated. There are countries that decided to let it go in that way since the beginning. We didn't want that because we were scared to have impacts in health and not end up like Italy or other countries. So that is what we have to be able to have as a balance. You open things progressively, you measure, you open up a little more, you see what's going on, and we'll be getting back to normal, because it would, of course, be unsustainable. I mean, I'm very, I miss my families. I can understand the parents and grandparents. It would be untenable. I even have colleagues telling me that we're going to allow people to go back out again, but the social distancing, the gathering, we're still going to have to avoid that for a bit yet, and we'll be measuring that as we go, and our advice will take that into account. So if we realize that a reopening creates too many problems or people are not compliant, I think I'm going to trust Quebecers. We don't want to constrain people for too much longer, but if there are people who don't respect and they make it that we go over our capacities in intensive care or elsewhere. We don't want to experience that in Quebec, to have to choose between two people. What do you say to people 70 years and over who heard what you said yesterday and who were really shaken up by it? Well, I understand. And it's, to a certain extent, it's not fair, that people who are 70 and over are those people very often who are the most alone. And now we are forced to say that since they are the most vulnerable people, we're going to have to stay 2 meters away from those people, perhaps longer than the young ones. That's the reality. I do find it very hard. But it's to try to protect them, because we can see it in the death tolls. We're not doing this for fun, it's serious. There can be very serious consequences for people who are 70 and over. So I find it hard, but at the same time, it's the best choice that we can make. And if we want to keep them, around for a long time. And if you allow me, the more people respect the guidelines, the more people, walk around, for example, at a 2 meter distance, and people can't go and meet up at somebody's home, the more that this is going to be done, and the more we'll be able to reopen things and let things go, because your behavior could not hurt you, but it can hurt somebody else.
Bonjour.
Hello. We have the impression that there is a dissonance between what you're saying and what Mr. Trudeau says. Mr. Trudeau said that we wanted to start finding a normal life only when there will be a vaccine. We're talking about a year and a half. Again, this morning he talked about maybe a partial recovery of the economic activities this summer, whereas we hear you talk about the next few days. You were talking about the fact that we could start working in the residential sector the next few weeks. How? And there's the World Health Organization that says we have to be very prudent when we talk about deconfinement, that there's a big risk associated to that. And now we're thinking about reopening the schools before the 4th of May. How do you explain that lag between you and the federal government? Is Mr. Trudeau more in phase with public health and you more with the economy? No, me on my end, I try to have a balance between health and the economy. But the situation is different from one province to another. We had to be careful. We had a conference call. We have one every Thursday evenings from 5 to 7. And we can see that there are provinces that perhaps have not yet, that they don't have a lot of cases, but do not exclude having them in the next few weeks and months. So Mr. Trudeau is trying to look at all of it in general, and we are looking at our reality. And also we have to be prudent. There's the economy, there's schools, there's younger people, there's older people. So everybody has their strategy, and it's been unanimous. The provinces do not wish for the federal government to use the emergency measures to impose choices that would be the same choices in every province. I think that it will be up to each province to look at their situation and to evaluate what is best for the population. And I felt today, and I read what Mr. Trudeau was saying. I saw the word, the expression a few weeks in a few places. So yes, we have to, be able to dose it, have a good dose and know how to measure things out. Mr. Arruda, the possibility of opening before the 4th of May, because we're talking about how difficult it is to apply social distancing, do you think it's a good idea to deconfine in this way? Well, I think that society has to come back, and it's going to be very important that parents understand as well what we're doing. As we're saying, the epidemiology makes it that young children are not ill. There's always possible exceptions, but excessively rare. So we have to have that balance, if you'll allow me. We have to have that balance between a part of the population because the more the children are immunized by the disease, the less are going to become active vectors with the elderly population. And up until now, we've been very much in phase with the governments, and our advice is taken into consideration. But I think that we have to understand that the World Health Organization, the WHO, when they give recommendations, they do it with general information. Because if I could, make sure that all Quebecers of 70 and over and have never contact with anybody else, we wouldn't have constrictive measures. If we made it, it's because people would not always follow. And I think that we have to have analyses that are based on our data. Because is the Quebec population going to behave the same way as in British Columbia or Ontario? I don't know, In British Columbia, they weren't bombarded. They have a lot of people from China who came, but when China closed down, they stopped being bombarded. We were bombarded. We're going to have a look at the population, the movement. What is the percentage of people from France who came during the critical period, for example? So that reopening is not an on-off switch. It's like, we did off with a temporary break, and now we're going to have like a dimmer. We're going to turn on the light, and we're going to measure things slowly. And, otherwise we could have an increase of violence, beaten children. All of that is associated to confinement. And, at one point people are going to go crazy if they're always, stuck between four walls. And I think that we have to take into account the response of society. And also, provinces have not all taken the same measures. For example, there are provinces that did not close down all of construction. Some did not close all the manufacturing companies, and some did not close all the mines. So we were pretty strict. Probably the province that did the most quickly. But there are places where it was not closed, those sectors. So, of course, we are at the stage of reopening them. They are already reopened. And something important, we changed the way that we work. Yesterday I went to a little dep close to my home by keeping distance and all that. There was a plexiglass, something that had never been done. We had been recommended it for years for the prevention of infection. So we'll also have transformed the way that we do things. And there's probably going to be less flu and colds in the next seasons because people are going to be more careful to not go see their grandmother or their grandfather when they are sick. These are things that are going to make that our society will have learned through this ordeal. But at some point we have to leave also this phase of ordeal that is a bit too stark. There's information that we got that there's a ministerial decree being purported to force workers in the education to go work in the health sector that would be requisitioned. For example, professors in nursing sciences. Are you confirming that? And what would happen what would happen to somebody who would refuse being requisitioned to go into the health domain? So yes, we are talking with the education sector to set up modalities in order to have the contribution of people from the education sector, for example, professors in school boards as well as CEGEPs, to come and help us, for example, in nursing sciences. There's a certain number of them, and I can tell you that there's been a link with the unions, obviously, and the answer is that people realize how serious the situation is and how much what our needs are. And a part of those people, I would say, are already with us in the network. They're already working in the network, so we want to get more. And I think that we've had a pretty good response. And those people are really going to support us a lot. And I'm referring here as well, many people have seen it, the president of the Respiratory Therapists Association who says, I leave my office and I'm going to go help out. And that's what we're asking. We're asking people who have a very important function, like teaching. And we don't want to put in peril the academic resources. But there are people in that pool who can really bring a very appreciated contribution in our CHSLDs. So that is really for those people, for CHSLDs, that we made that request. Because in our network, we are using everybody that we can. We have redeployed people from the hospital sector, but we have to say that there still are a lot of people, for example, pregnant women. We have 3,000 who cannot be right there, people who are 70 and over. Also, workers who were affected by COVID-19 and the contacts So all of that and new activities, evaluation clinics in the field, the 811 phone line, we've added a lot of activities. And when we treat COVID-19 in a hospital setting, it takes longer. It takes more people because you have to protect yourself. There's all sorts of elements and steps that have to be taken that did not have to be taken so much before because it wasn't necessary. So that is why we are happy that they come and help us out, and we salute them. I think that is going to make a huge difference.
Monsieur Legault, j'aimerais vous entendre maintenant à propos des chiffres du chômage qu'on a entendus.
Monsieur Legault, about the unemployment numbers that we heard yesterday, I know that you are an accountant, you're passionate about economy, your government is supposed to be the government of the economy. What reading are you making of the situation, macroeconomically speaking? Well, first, the numbers that came out yesterday, what I understand is that those are the numbers that are based on the situation of the third week of the preceding month, so the third week of March. So, in fact, the amplitude of unemployment is a lot higher than what was in yesterday's numbers. We are, in fact, right now doing a sectorial evaluation of how many jobs have disappeared since the beginning of this crisis, in order to be able to give ourselves a plan to reopen those different sectors. But of course, the unemployment rate is a great deal higher right now than what we were able to see in yesterday's numbers. Thank you. English questions.
With Ketsone from CBC News.
I was, good afternoon to all of you. I was surprised, Mr. Legault, to hear that you're not excluding the possibility of reopening daycares and schools before May 4th. I would like to understand, I guess you want to give some hope before the beginning of the long weekend. It's less depressing to hear that things will start over again, but I want to understand why you came up with this today with physical distancing. That's a huge challenge for schools and daycares. So.
But for the last 4 or 5 days, we had good results, and we can believe that we're getting closer to the peak. And as soon as we'll reach the peak and start to decrease the number of cases and the number of people in our hospitals, we'll be able to relaunch the economy. And of course, if we want eventually to relaunch totally the economy, some parents, some workers, they have some children. And those children, if they're not at school or in a daycare, they are at home, so they cannot work. So it all goes together. Nothing is decided. So we're looking at different scenarios. We have 3 weeks from now until May the 4th. So what can we do gradually? Nothing is decided. And of course, we'll watch very closely the results of the next few days, few weeks. We'll have discussion with Dr. Arruda and his team, and we'll take the best decision. I don't want to take any risk that is too high, but at the same time, we need eventually to restart the economy and give hope to the population.
Just a clarification, Mr. Arruda, about physical distancing in daycares and schools. I mean, how can we do this?
There's different strategies that can be analyzed by using different spaces than the one we are used to do, lowering the number of kids at the same time in a place. So this is all kinds of scenarios we're looking for. And what is helping is that kids, even if they get the disease, they will not be going to the hospital, and they're going to be almost immunized against it, and they will not contribute to giving the infection to older ones. It's why we want to give this separation between the ones at risk with the ones which are not at risk. And it's almost like having, I would say, a vaccine. As we did before with varicella, you remember one kid was sick, we want them to get out. But at that time, now there is a vaccine, and there is some rare cases of complications, so why are we using it? So it's this equilibrium that we're going to look, and we're going to open, I would say, the robinet or the thermostat or the rheostat, like light, and measure measure. And you know, if we don't do that, people are going to get crazy. We're going to have depressions, suicides, all that kind of stuff that could happen if we are confined for a long time. So it's also, we don't want to have, I would say, a system which will be overwhelmed by cases, but at the same time, we want to prevent other issues of public health too.
Thank you. So our next questions are from Raquel Fletcher, Global News. 2811 employees have COVID-19. Their union says they can't social distance and to work from home. Is the ministry following its own rules?
Can you tell me again, where is that?
811.
811. I'll look into that because we have to apply the same rules in the ministry as everywhere else. So I will look into that, and we should respect the 2 meters as much as possible. And it's also possible for the 811 to work from home and to do the télétravail. So I will look into the situation.
Thank you. And now for Mr. Legault. The unemployment rate in Quebec is now 8.1%, a 3.6 increase over February, which is the highest increase in Canada. How concerned are you about the labor market and the Quebec economy? Is Quebec currently in a recession?
First, unfortunately, the unemployment rate is a lot higher than 8% right now. So the figures that were tabled by the Canadian government yesterday only represent the situation of the third week of March. So it's not the picture that we have today. So yes, the situation, the economic situation is very tough. Like I explained before, we decided to close many companies in order to save the more vulnerable of our society. Now, in the next few weeks, we'll look at reopening businesses and help also businesses that need some help. There's some help that is already coming from the federal government, and our Minister of Economy, Pierre Fitzgibbon, is putting together a plan to restart the economy. We would like also to do more than less infrastructures in order to create jobs to reduce the unemployment rate. But unfortunately, in Quebec, like in everywhere in the world, the unemployment rate will be very high, is very high right now, and we hope in the next months that we'll be able to reduce it.
And now a question for Phil Autier, Montreal Gazette. Families are reporting that the number of deaths in some CHSLDs you mentioned yesterday are in fact much higher. At the CHSLD Alfred Desrochers in Montreal, the head of the resident committee says the number of deaths there is 17, not 5, as you said yesterday. How do you explain the difference?
I have
yes,
the figures still in front of me, and it's still 5. So
You must understand that there is a need for declaration of the deaths at the clinical perspective to the public health, and then to public health to put it in the system. And there is some delays. It's normal, even because even the doctor must sign exactly with the certificate of dates. So, and I'm suspecting that perhaps there is some people dying or who died yesterday who are not still in the system. But we must go with, I would say, the official numbers. That's the only way.
Thank you. Now for Premeir Legault. The peak of the epidemic has not happened in Quebec yet, but a lot of discussion at these news conference is about lifting restrictions. Is it giving people false hope to talk about getting back to a normal life this early?
no, I think that first, people in Quebec, they need hope. Second, if we want to restart the economy, we have in certain sectors, like for example in construction, we need to negotiate an agreement with the unions. So it's the right time to start looking at different scenarios, and we'll look at the results of the next few days. We'll discuss with Dr. Arruda, and we'll take the decisions at the right time. But I think it's normal at this point that we look at the possibility of reopening, and I think we have good reasons right now to believe that we're coming close to the peak.
Thank you. And our question today from a media that is not represented here at the National Assembly is from CTV News, City News Montreal. Sorry, it's a question for Premier Legault. The Supreme Court of Canada denied the application to appeal Bill 21. Several civil rights groups had asked for the bill be suspended during the full legal challenge. Can you comment on that decision?
But as you can understand, we're very happy that we won this case and that the Bill 21 will be able to continue to be applied.
Et on me demande si c'est possible de répéter en français sur cette...
And could you repeat this in French? Well, listen, we are happy with the result. We were talking about the suspension of Bill 21, so there will, of course, be other resources or other recourses, but right now we're happy that the request to suspend the application of Bill 21 has been refused. Happy Easter to all those who can take advantage of it.